physical therapist on the internet.
Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about what is causing the pain behind your knee and how to tell. So there's many different issues that could be causing pain behind your knee. The point of this video is that you're not going to self-diagnose it. It's just going to help you when you see a professional.
Give you some background information.
Right,
Yeah.
right. So we'll give you some of the common reasons, and again, so you'll be going to your a doctor's appointment informed.
Right.
So one of the ones that I hear about a lot is do you feel a bump behind the knee or fluid behind the knee, and that's a cyst. A cyst is usually the result of a problem that you have inside the knee joint.
Mm-hmm.
So it could be arthritis or something like that. And these conditions cause inflammation and increased fluid. And that fluid seeps into a bursa behind the knee. What's a bursa?
You want me to take?
It's a fluid-filled sac.
Right. It's all joint. You have them all over your body at joints, and they help provide a lubrication means for when a tendon or a ligament goes over a bone. But they can be very painful when they get inflamed or filled up.
The problem with the cyst behind the knee, it has a one-way valve. So fluid goes in, but it can't come back out again, Brad. So it's very difficult. That's why it often has to be drained.
Sure.
And it's called a Baker's cyst. Well, I don't know. Bakers get it? I don't know where that came from.
I don't know. Baker's cyst is very. I mean, I knew about that before I was in therapy. Just because it's commonly used.
Arthritis, just plain old arthritis, can cause pain behind your knee and can cause the Baker's cyst too.
Sure.
But arthritis is generally worse with weight bearing. Like when you put weight on the leg, it's going to get worse. Generally, it feels better once you're off of it.
Right.
It's kind of stiff in the mornings quite often.
Yep.
Or stiff with no movement.
Sure.
So, a cartilage tear. You might actually tear the cartilage in your knee.
Yep.
The meniscus. It might be due to trauma, or it might be due to just simple wear and tear as you get older. They start to wear out.
I just had one of my patients, he was putting things into the trunk. He hyperextended his knees. It went backwards slightly. Pain behind his knee for a number of weeks. I mean, it was pretty obvious to him that it came from that incident, that micro trauma, if it wasn't severe. But it stretched it, and he was painful.
Yeah, now with the cartilage tear, you could have swelling, pain, decreased motion because the cartilage could kind of get folded up or block the movement a little bit.
Right.
You could get locking of your knee, like locks up. You hear a creaking or popping of the knee. All these things.
As we get older, it's not uncommon, those noises.
So one test you can perform, and some of you might be listening on a podcast, but I can describe it to you. It's called the duck walk or the children's test. Basically, it's designed to stress the cartilage in the back of the knee.
Okay.
So all you do is you squat with the knees turned out to the sides. And you can hold on to something while you're doing this. And if you can't get down at all because of pain, that's a sign right there. You might have torn cartilage.
Sure.
But if you can get down, you try to walk like this.
And if you don't feel steady, don't do it. Obviously, it's not worth falling.
Safety first. We're trying to relieve your body of pain, not try to cause pain.
Right.
So, all right. So if you feel clicking or increased pain, you may have some cartilage damage.
Sure.
So, a ligament tear, that's generally caused by trauma, and that's not something that just develops.
Right.
So, that'd be more of an athletic accident or athletic injury.
Yeah, or maybe a fall, or you caught yourself and you nearly fell. And sometimes you don't fall, but you
just hyperextend your knee.
Or try to catch yourself and there's a jerk on your leg. Something like that could cause it.
Yeah, so there's 4 ligaments, and we don't need to go over those, but that would be something the doctor would check out. With ligament tears, the pain tends to be sudden and severe, so it's usually, you might even hear a pop or a snap.
Yeah.
So it's usually pretty easy to diagnose. You could have a simple muscle strain
Right.
or tear or tendon tear behind the knee.
Might be a hamstring issue, which is pretty common. That's those low hamstrings are probably not as common as the mid
Right,
or
or
the upper, but
right,
it's
and
still,
also your calf muscle
sure,
goes up across your knee.
Yep.
A lot of people don't know that. So
gastroc,
yeah, you may find point tenderness in the calf or the hamstring muscle. Again, something to keep in mind. The last thing I want to mention is it could be a blood clot, which you can feel in the calf sometimes and behind the knee.
right,
Less common. We did do a video, is a blood clot causes the pain in your leg. You can check it out. It's as part of the series of videos on knee pain.
right.
And so go to bobandbrad.com, go to the program section. You'll find our one on knee pain. There's like 30 to 40 videos. Check them out. Watch the ones that only pertain to you. Don't.
Yeah. The title will be clear. Look at the title.
Yes.
If it pertains to your question, watch it. And right next to that, you can click on a PDF printout, and you'll get a review of the whole video, including the exercises. It's very handy to have and keep it. And you don't have to go back and look at us. You can just.
And what are we charging for this now, Brad?
Good point, Bob. We are doing absolutely no charge, not even your email, which is pretty
That's
unusual.
right. We don't want anything from you. We just want good vibes.
Right. Yep.
So,
There you go.
all right. Check it out.